You see, the virus is continuing to change. It's mutating, and it forms new types of virus that have different capacities to infect. And also, they do seem to be able to start breaking past the defense that's there from the vaccines. And so, as well as using vaccine as part of our defense, we're going to have to continue by keeping a bit of a distance from each other. And I'm going to suggest that the physical distancing part of 1 meter plus and mask wearing will be necessary, particularly in places where there's a lot of virus. We can't just simply ignore that. So we've got to keep the precautions in place. We've got to have really good test, trace, and isolate systems that can pick up people with disease and get everybody isolated if they need to be. And at the same time, we will have to continue with the vaccination program, and it will include boosters.
So are you saying that people who are working in offices should still wear masks and be more than a metre apart?
There will be a need for every single workplace to be asking, is it right that we stop wearing masks and stop maintaining distance? Because that's the way you prevent people from getting infected. And that's the key to stopping big spikes building up. I personally am okay about trying to find ways to get groups together again. I'm okay about trying to restart the economy because that's what has to happen. But I'm also saying the virus is still in our midst and the virus is mutating. So we have to go on being careful about it. And I am advocating continued physical distancing, continued mask wearing for the time being, including in countries where there's a lot of vaccination.
How are you feeling, Dr. David, about the Delta Plus variant that we're hearing about? It's only a handful of cases at this stage, but it is being picked up.
Yes, and that issue of variants is what we're watching all over the world. They are going to go on coming. We will go from Delta to Lambda and then on to the other Greek letters. That's inevitable. And some of these variants will be troublesome. They will be able to break through the vaccine-related protection in a few people, and that will cause problems. I'm basically saying variants are going to go on coming. That's part of life. We need to pick them up fast. We need to move quickly if we see them in a certain location. And we need to build the management of variants into what we call our COVID-ready strategy, which is going to be the pattern for the foreseeable future.
And how are you feeling, Dr. David, about people flying around the world?
You know, we really need to be careful about this. Only absolutely essential travel. Now, essential can be essential for emotional reasons as well as essential for work reasons. But essential really matters. It's not yet the time for unrestricted travel to start. There are too many risks, I believe, and I think that the possibility of initiating another major explosive outbreak because of an event in a particular location that's done for leisure, it's too serious. So I'm basically suggesting keep being aware of this virus and keep working hard to avoid it, and don't do shortcuts, because just because we want to be strong in the face of the virus doesn't mean that it curls up and goes away. No, it can come back with a vengeance. So keep recognizing it's there, keep behaving carefully, and don't do things that you don't need to do.